Good day, everyone. I will discuss enterobiasis or pinworm infection in this video. It's a very common infection among children and also persons living in institutionalized homes. What is the causative agent or etiological agent of enterobiasis? The etiology of enterobiasis is Enterobius vermicularis, the pinworm. The life cycle of Enterobius vermicularis is simply put as follows. Adult worms are about 1 centimeter long and dwell in the lumen of the large intestine. Following fertilization between the female and following copulation between the female and the male, the gravid female worm migrates nocturnally out into the perianal region and releases up to 10,000 immature eggs. These eggs become infected within a few hours and are transmitted by hand-to-mouth passage. The larvae then hatch and mature entirely within the intestine. Perianal scratching and transport of infected eggs on the hands or under the nails to the mouth results in self-infection. Pinworm infections are common among family members and institutionalized populations, such as the barracks, due to the ease of person-to-person spread. Here is the life cycle of Enterobius vermicularis. Here, the human host passes the asymmetrical eggs, or rather they are found on the perianal skin because the gravid female migrates nocturnally at night and deposits the eggs. These eggs are not found in the feces, but they are found in the perianal regions. So the larvae are found inside the eggs and mature within 4 to 6 hours. The embryonated eggs are ingested by humans. They are found under the nails, and by hand-to-mouth transmission, they find their way into the gastrointestinal tract. Specifically, the larvae hatch in the small intestine and simply become sexually differentiated male and female adult worms in the lumen of the caecum. Epidemiology of enterobiasis. By direct infection from a patient or auto-infection, the eggs are infective as soon as they are passed by the female worm. If the hands of the patient get contaminated with these eggs, he or she will infect himself or herself again and again. And it's important to keep the nails shut because these eggs can hide, or they can be found below long nails. Rarely, aerosol inhalation from contaminated sheets and dust can cause enterobiasis in family members living together. Excuse me. What are the clinical manifestations of enterobiasis. Most pinworm infections are asymptomatic, that is, there are no symptoms. But the cardinal symptom is perianal pruritus, that is itching of the perianal area. This itching is worse at night because of the nocturnal migration of the female worms. These may lead to exploration and bacterial superinfection. However, it should be noted that heavy infections have been claimed to cause abdominal pain and weight loss. On rare occasions, though, these pinworms invade the female genital tract, causing vulvovaginitis and pelvic or peritoneal granulomas. Laboratory diagnosis of enterobiasis will involve looking for the eggs in the perianal region. The diagnosis cannot be made by looking for eggs in the feces because the female worm lays eggs in the perianal region at night. However, these eggs, which are deposited in the perianal region, can be detected by the application of the clear Scotch cellulose acetate tape to the perianal region in the morning, first thing in the morning before the patient takes his or her bath. After the tape is transferred to a microscope slide, low power examination will reveal the characteristic asymmetrical eggs with the developing larva in it. The eggs are oval and are flattened along one side. Prevention and control of enterobiasis. Personal hygiene is very important. And where a child seems to have these symptoms, particularly the perianal pruritus, the nails must be kept short. All affected individuals should be given a dose of mebendazole, albendazole, parental palm weight, with the same treatment repeated after 10 to 14 days. This treatment is important for household members, family members, to eliminate asymptomatic reservoirs of potential reinfection. Here are some links for further reading. Thank you for listening.